Geriatric Syndromes, Dementia. Heather Weeks, East Tennessee State University, November 11, 2018. Dementia is a permanent and progressive loss of brain function. It can affect not just memory, but judgment, language, thinking, and behavior. Any dementia that is primarily caused by impaired cerebral blood flow is classified as vascular dementia. Vascular dementia is the second most common form of dementia and accounts for between 25 to 50% of all dementia cases, exceeded only by Alzheimer's disease. It's typically diagnosed following a stroke with cognitive impairment or through imaging studies identifying vascular brain injury in a patient with cognitive decline. Brain injury occurs when blood flow is impeded for longer than just a few seconds. 10 million new cases of dementia are diagnosed worldwide each year. That amounts to one patient every 3 seconds, and this is set to triple by the year 2050. 1 out of every 10 men and 1 out of every 6 women over the age of 55 will be diagnosed with some form of dementia. In 2015, the estimated cost to society for conditions that affect the brain was $818 billion. By 2030, it is predicted to cost society upwards of $2 trillion. With the surge of baby boomers reaching retirement age, the number of Americans aged 65 years of age and older is set to double by the year 2030, which will significantly increase the demand for nurses and healthcare services. With the increasing number of patients being affected by vascular dementia, it is almost certain that we will take care of a patient suffering from this disease. Subjective data. The patient in this case study reports having no known drug allergies. Current medical history includes hyperlipidemia, hypertension, vascular dementia, TIA, vitamin D deficiency, angina, depression, and anxiety. Her current medications include atorvastatin 20 milligrams by mouth nightly, isorbid mononitrate 20 milligrams by mouth twice daily, lisinopril 20 milligrams by mouth daily, Plavix 75 milligrams by mouth daily, Lexapro 20 milligrams by mouth daily, Aricept 10 milligrams by mouth nightly, Ativan 1 milligram by mouth twice a day as needed for anxiety, and vitamin D3 2,000 international units daily. She currently reports being up to date on her vaccines, which include zoster vaccine in 2015, flu shot in 2018, and a pneumococcal vaccine in 2016. Health maintenance and lifestyle. This patient walks several times weekly, participates in her water aerobics classes approximately twice a week, attends reading and knitting clubs, and attends movies and plays bingo weekly with her friends. She is active in her homeowners association and community card playing nights at the clubhouse. She lives in Vero Beach, Florida, with her husband and 1 cat in a safe subdivision. She is friendly with all of her neighbors and states she is very happy with her current living arrangements and lifestyle. Past medical history, she states no childhood illnesses. Her surgical history includes a cesarean section in 1970 and again in 1974, bilateral carotid endarterectomy, left side in 2003, right side unsuccessful in 2004. Hospitalizations for childbirth in 1970 and again in 1974. And in 2014, she was hospitalized for a fall which required surgical intervention to a leg wound, result of a possible TIA. She reports no blood transfusions. According to Domino, patients with vascular dementia may present with cognitive impairment, sleep disturbance, confusion, memory and language difficulty, personality or mood changes. Per Domino, common complaints include memory loss such as where things are placed, loss of words, muscle weakness, gait disturbances, and problems with reflexes. Objective data. 75-year-old female with stable vital signs, temp today of 98.0, blood pressure 132/70, height 5 feet 3 inches tall, weight 142 pounds with a BMI of 25.2, heart rate 58 beats per minute, respiratory rate 18, with an oxygen saturation of 98% on room air. On physical appearance, she's well-dressed, well-developed woman who appears to be in no acute distress, appears stated age of 75 years old, alert and oriented. No abnormalities seen to her integumentary, head, eyes, nose, throat and mouth, neck, lymph nodes, chest, breasts, lungs, cardiovascular, and peripheral vascular. She does wear corrective lenses. No abnormalities were seen in her abdomen, as well as her coordination and reflexes. Screening tools implemented were the mini mental status exam, which revealed no cognitive deficits, the clock drawing test, which also revealed no cognitive deficits, and the Geriatric Depression Scale of 6. Below are some of the pertinent lab tests and diagnostics from June of 2018. Treatment will include continuing on current medications with aspirin, statin, SSRI, and ACE inhibitors. She will discontinue her cholinesterase inhibitor, Aricept. Studies show that these medications have little or no benefit in vascular dementia patients. Aricept is indicated in Alzheimer's disease only and is associated with numerous side effects. She should implement lifestyle modifications such as weight loss, increased physical activity, and alcohol cessation, as well as improving her diet. Differential diagnoses include Alzheimer's disease, depression, drug intoxication, CNS tumor, hypothyroidism, and vitamin B12 deficiency. All of these diagnoses can be ruled out with simple screenings, including lab work and MRI. Lab tests were within desirable ranges, and MRI did not reveal any amyloid plaques and tangles associated with Alzheimer's disease. The final diagnosis is vascular dementia, diagnosed with history and physical exam in conjunction with MRI, which shows several areas of damage, decreased blood flow to the brain, and white matter changes. Some challenges with the disease include lost cognitive abilities, non-compliance with lifestyle modifications, non-adherence to medication regimen, and physical disability. Some community resources which may be able to help include Meals on Wheels, which provides nutritious meals for homebound seniors, Silver Sneakers, which is a basic fitness program provided at no cost, dementia support groups, community-based programs offering support and guidance to patients as well as family members. The Alzheimer's Society 24/7 support helpline and link for referral services at 1-800-272-3900. Health team to include primary care physician, the neurologist, the cardiologist, physical therapist, speech therapist, and respite care. Patients' health behavior include exercising 2 to 3 times weekly, excessive alcohol intake. She has a history of smoking as well as a prior history of stroke and hypertension. She has a poor diet, lives with only a husband, so most of her meals or restaurant or fast food. Social determinants include her advanced age of 75, a limited education with a high school diploma. She does have good social support and numerous supportive family members in the area. She does have available transportation and community resources available. Legal and ethical considerations include when to surrender her driver's license and when to discuss and establish power of attorney, code status, and end-of-life care. Socioeconomic and cultural considerations include loss of social skills, social isolation, dependency, loss of independence, financial burden, caregivers, medication, and medical costs, as well as family decisions regarding future care, such as nursing home or assisted living. While there are many types of dementia, this presentation focused on vascular dementia, the second most common form of dementia. Through my research, I have learned that lifestyle modifications and reductions of vascular risk factors can possibly prevent vascular dementia and disease progression. Prevention is the key to treatment. Vascular dementia is a decline in cognitive function that can be devastating to not only the patient but to family and friends. The disease is progressive and irreversible. Neurologic and cognitive testing should be done routinely to determine if and at what rate the disease is progressing. A good support system and education is important for both the patient and family members to assist with better coping skills, mental health, and a healthier, longer life. Here are my references below.